surgery or radiation that didn't work. Now, I'm telling you, there's a guy out there who is clearly the best at this. First tryout or second tryout, that's Dr. Gil Lederman. My personal experience in 1991 is he came up with a remedy for my dad. Others had passed on it or just couldn't figure it out. He was able to save my dad's life, and my family will always be grateful to him. But look, if you have newly diagnosed and recurrent cancers anywhere in the body, Gil Lederman's the guy to go to. He's a brain and prostate cancer as well as body cancer expert, also treating breast, lung, pancreas, liver, kidney cancers, and more. So, to hit the cancer, you call 212-CHOICES and set up an appointment with Dr. Gil Lederman, 212-CHOICES. Or do it for someone that you know won't do it for themselves. He'll send you an informative booklet, DVD in advance, and then you cop a squat with him at his offices at 38th and Broadway. Dr. Gil Lederman takes most insurances, Medicare, and Medicaid. Just call Dr. Gil Lederman for your cancer treatment choices at 212-CHOICES, 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
We're back. It's Dr. Lederman. You're welcome to call us if you have questions. We're live. We're talking about cases. We're learning from cases. We're learning from scientific articles. We're learning so that you can learn from data that's out there to have a better life, a healthier life, and to avoid the risks and complications that go on to so many. The next patient I want to talk about is a 50-year-old black woman who came in with her daughters, had daughters, granddaughters. She came in with lung cancer. She was diagnosed in a neighboring state. She had treatment at a big hospital and then went to another big hospital in a neighboring state. She's been having chemo for a year, and she's getting worse and worse and worse. She lost about 50 pounds. She's very short of breath. She came in with headaches. And her doctors have been seeing her every week. I saw her, and I was shocked that she had these new headaches. And she's sitting there. I asked, but she's telling you she had new headaches. She's not feeling fine. And no one evaluated her. So we got her staged up to know where exactly the cancer is. We got the old images so we could compare the new and the old. The cancer in the lung was about 3 centimeters before. Now it's 7 centimeters. On chemo it grew, and it's up against the airway, blocking the airway. So, of course, she's short of breath, and of course she's feeling terrible. And, of course, the cancer is growing on chemo. And then we did the same day, and she's been going for a year elsewhere, not getting answers. The same day we staged up her body and her brain. We got an MRI with contrast to the brain, and she had multiple brain metastasis. That was what was causing her headaches and making her feel so bad. And this was all done in one day. She came to me, we got everything done in one day, got all the answers. She got reports, she got the discs. We got treatment going, and she's already feeling better. So, wow, isn't that what everyone should have? A doctor who listens to the patient, finds out where the cancer is, compares it to the past. If someone's doing great, and you'll hear later in the hour, a patient doing great on chemo and radiosurgery, we tell them. But if they're not, we also tell them that. We're not afraid to tell them the answer. A patient deserves, and the family deserves, to know what's going on. You can't live in a black hole getting chemo when it's not working. So for this woman, we found her cancer. We're going to hit the lung with 5 treatments, radiosurgery. Radiosurgery is non-invasive treatment. There's no cutting, no bleeding. We make a special frame that's not claustrophobic for the patient. It's custom-made for each patient. We then computerize the patient's body, the cancer, and we send beams in to hit the cancer and avoiding the healthy tissue with the dose. That's how radiosurgery works. And because it's more focused, there's fewer treatments, and because there's fewer treatments that are higher dose, it's more effective. it's more effective in helping stop or shrink the cancer. So we're very confident we have a 90% chance for lung cancers to stop or shrink the cancer. And brain, ditto, we're treating her new brain metastasis, which we discovered upon listening to her and examining her. And we're treating her, and she's already better within days of coming to Radiosurgery, New York, which is at 38th and Broadway. There's a new article. I want to move on now. It's a new article that looks at low-grade gliomas. Low-grade gliomas are kind of usually thought of as a boring topic because they're fairly rare. There hasn't been much data. We certainly treat low-grade gliomas with radiosurgery, and radiosurgery allows us in the brain to use the dose where the brain tumor is and not where the healthy brain tissues are. So we were the first ones in New York with brain radiosurgery and one of the first in America with fractionated brain radiosurgery. So when we treat brain tumors, there's no screws in the head, there's no hospital stays, there's no cutting, no bleeding, no anesthesia. Our systems are relocatable, non-invasive, not painful, not claustrophobic, and yet we can focus in, hit the cancer or the tumor in the brain, and we do treat benign tumors in the brain like acoustic neuromas, meningiomas, pituitary tumors, and in this case, low-grade gliomas. And a recent study compared radiation alone to radiation plus chemo, procarbazine, lomustine, and vincristine, PCV chemo, and found that the patients who got the chemo and the radiation lived longer. There was a longer progression-free survival and overall survival. So in this study, it was RTOG. It's been reported by the ASCO, which had its national meetings just last week. They took 251 patients with grade 2 astrocytomas, oligoastrocytomas, or oligodendrogliomas, and randomly allocated radiation alone or radiation plus PCV chemotherapy. The results were published in the Journal of Clinical Oncology first, and they demonstrated that radiation and PCV had an increased progression-free survival, and the new data with follow-up on average of 11.9 years showed that patients who got combined radiation therapy lived 13.3 years compared to 7.8 years with radiation alone. So it's a very important study for those with low-grade gliomas. If you have a low-grade glioma, newly diagnosed or recurrent, give us a call and we invite you in to discuss treatment options, hopefully that can extend your life, like we've spoken about here, years of life. Years. And the good news department. We finally got to the good news department. This is a 65-year-old Russian woman, been in the United States for 20 years, has 2 children. She has metastatic colon cancer to the liver and lung. She had 3 spots of cancer in the liver, which were the big spots. Those were the most dangerous spots. Usually when someone comes to me, I treat the worst area first. Because if I can show them that we can successfully treat the worst area, then they understand from that the easier areas are easier. So this woman came to us March 25th. It's now 3 months. We treated those 3 cancers in the liver. We got follow-up. We compared the testing now to those before treatment, and all 3 metastases have shrunken in the liver with just a short time, and most likely, statistically, they will continue to shrink over more time. Now, she had a couple of tumors in the lung, which we did not treat. She asked us to treat the worst ones in the liver. The tumor that was untreated in the lung has grown. The cancers in the liver, which we treated, have shrunken. She now has the confidence to ask us to go ahead and treat the lung metastasis, which we are now preparing to do, and she'll have her first treatment next week. So it's great. She had pain before. The pain from the cancer in the liver has gone away. The cancer in the liver is shrinking. She's refusing more chemo. She had chemo before and didn't work. She's ambulatory, fully functional. She comes in by herself from Brooklyn, gets her treatment. Usually it's 5 treatments to a spot, and then she goes back to her normal life, taking care of her family, taking care of her home, cooking, and some days, on good days, she even brings us apple turnovers. So thank you for the apple turnovers, and thank you for your trust in allowing us to treat your liver metastases, which have now all shrunken. And we have another woman, interesting woman, who came to us with metastatic cancer, similarly in the liver, all shrunken also. So we had a lot of follow-up patients this week, and I want to report to you. Now here's a patient, a Hispanic patient from South America. She's been in the United States for a long time. I've been seeing her for 10 years. Now, usually when someone has metastatic cancer, if they go to the chemo doctor, and I'm a chemo doctor. I'm board certified medical oncology. I trained at Harvard Medical School, Dana-Farber Cancer Institute. I'm a chemo doctor, but I've moved on to greener pastures where I believe we most commonly get better results, not always, but most commonly. So this woman has a head and neck cancer, means it started in the head and neck area, and it's traveled. She's been with me 10 years. She doesn't want chemo. She doesn't believe in chemo. She's had it. I know chemo people often tell her, well, if you have cancer, it's systemic. You have to have chemo for the rest of your life. She didn't want to hear that. She didn't believe it. She refused that. Some years, like right now, we're treating several nodules in the lung. So she has stage 4 cancer, head and neck cancer spread to the lung. She's fully functional, and she's been this way for 10 years. So some years we'll treat if the cancer is growing. Other years, no treatment. We haven't treated her in several years. Now she's got several nodules in the lung. We're hitting those nodules. Most likely we can stop or shrink those nodules or even make them disappear. And she's avoided 10 years of chemotherapy to have our radiosurgery with a good quality of life, good function, carrying on normally, pain-free. This is Dr. Lederman. We're at the Radiosurgery Hour on WABC. We're taking your calls. We're at 1-800-848-9222. We have a free booklet DVD, which we're happy to send to you. Our office is located at 1384 Broadway, 1384 Broadway, which is the corner of Broadway and 38th Street. We're just by Macy's and Times Square in Manhattan. We're close to almost all the buses, subways, trains. It's very easy to get to us. If you're on Long Island, we're close to Penn Station, a few minutes from Penn Station. And if you're close to the other trains going into Grand Central, ditto, we're very close to Grand Central Station. And the buses, the Port Authority. So the place is not only super convenient, but it's super. There's no students. There's no answering machines. You can talk to a human being. It's a private cancer treatment center, meaning you're the boss, not the drug companies, not the surgeons. You're the boss, and you get to hear all the options, and you get to decide which treatment you'd prefer that you believe is best for you, just like these other patients that I've talked about this morning. So we're going to break for a word from several new voices, and then we'll be back to take your calls, hear new cases, and hear new news. This is Dr. Lederman.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan.